Welfare and Charitable Trust as part of our 10th anniversary series of activities. Today we are gathered to extend our thoughts into an incredible pertinent topic: inflammation and integral role in pain, heart disease, diabetes, cancer and beyond. Now I call upon Mr. Mohan, our founder, to welcome the gathering.
Good evening. Thank you everyone. To join on a Sunday evening is not that easy. So first of all, thank you all for taking time to support the journey of Vaishnavi Trust. I'm sure most of you have personally heard from me, but still it's always a pleasure to talk about. It's been a fantastic 10 years. Incidentally, this is kind of, you can say, a mini anniversary celebration. We'll have a formal 10th anniversary also soon. So it's a happy thing to recall that we have been very successful in addressing malnourishment among the poor children. I had some personal experience with Ayurveda, and when I asked the doctor what's the best way to give back, she said, malnourishment is the curse of India. So we have been doing work in different homes, and I just want to talk about Kalvarayam Hills, which we have recently started. For wrong reasons, Kallakurichi district became famous, but now with this project, for right reason, it will become famous. It's a tribal locality with about 50,000 population. The primary occupation is they go to Mysore and pluck pepper. So the government has built a lot of hostels, but when we did a data analysis about 5 years back, like 85% malnourishment kind of a place. Very deserving place. And then as we were doing malnourishment, we also realized that we have to start with the pregnant mother and do intervention. And the PHC requested us to do some support with Madala Manapag, and that has given some great results. My colleagues will talk as we go along. So as we were doing this journey with primarily on Ayurveda, we realized that the time has come globally that integrated medicine is the way, because there are advantages in different models. And then we have been very fortunate. Again, over the years, we always have been blessed with great donors, great support to do a program of this scale. For a small NGO, it's not that easy. And then the speaker, again we will talk about her. She has been a practitioner of integrated medicine. She's certified in gynecology and Ayurveda. Because including my daughter, when you try to explain, if you can explain in a way they understand, that really becomes helpful. So of course, allopathy brings in a lot of advantages and Ayurveda brings too. So how do we integrate these two? And so when I asked Malini, people talk, I'm sure everyone is getting bombarded by YouTube videos or whatever your social media thing is. There are so many things happening and everyone is talking about health. And when we were talking in our team, she said inflammation is the biggest curse. Whatever diseases you take, whether it's a heart disease, whether it's diabetes, whether it's Parkinson's, she said all can be linked to inflammation. So now we are trying to look at all the problems through the lens of inflammation. I will let the experts talk about it, not attempt to do that. So it's a privilege to have all of you to attend to this lecture by Malini. And then I also want to thank HDFC Mutual Fund for supporting this program. And again, thank you all, and over to Niremati.
Quick snapshot of Vaishnavi Trust. I also wanted to extend this talk on how Vaishnavi Trust has been functioning all this while. So I'll just run through the functions of Vaishnavi Trust. So now we have become a beacon of hope and health for children and communities across Tamil Nadu. Our journey began with Mr. Mohan, whose personal experience with alternate treatments inspired him to create a lasting impact on the community health now. Motivated by Dr. Girija's treatments, he saw the potential of integrating traditional Ayurvedic practices to improve overall well-being. At Vaishnavi Trust, we focus on addressing malnutrition and boosting immunity among children through the wisdom of Ayurveda. Our vision is simple yet powerful: be happy and healthy children the Ayush way. Our mission is to create awareness and tackle the malnutrition using Indian systems of medicine, thus enhancing the health and well-being of children. Through our flagship program, Jeevani Milk, we cater to children between the ages of 5 to 18 years in shelter homes, providing a nurturing platform that addresses their nutrition and overall health needs. We have already reached over 4,000 children, providing them with milk with Ashwagandhadi Churna, improving their overall nutritional status. Our impact extends beyond nutrition. With projects like Jeevani, we started Malnutrition Free Panchayat project in Tirunelveli. Our efforts in renewable solar power and river restoration projects demonstrate our commitment to creating a holistic environment for our children. Vaishnavi Trust is dedicated to creating long-term change. We are transforming Anganwadi centers into beautiful spaces for children to learn and play. Vaishnavi Trust has also established a herbal garden and training center to educate and provide livelihood opportunities to farmers and community. Their center has reached about 2,500 students and 300 partners and MGNREGA workers, empowering them with valuable knowledge and skills. Addressing the frequent power shortages at the Pechiparai Primary Health Center, Vaishnavi Trust collaborated with other organizations to install the solar panels. This sustainable solution meets the needs of the healthcare center and the neighboring community it serves. In Kanyakumari district, our work towards malnutrition-free panchayat has garnered attention, and we are proud to support around 900 children across 450 ICDS centers with protein energy-rich Nutri Laddus to combat malnutrition. Our community programs also support pregnant mothers, lactating mothers, and children up to 18 years. We launched the Shakti program, a project combating anemia in adolescent girls and pregnant women, starting with the tribal community at Kalvarayan Hills. We distribute Madalai Manapagu to pregnant mothers to improve their iron status. This initiative has shown a very distinct and positive outcome, significantly enhancing the health of these mothers. As we celebrate our 10th milestone in June, we look forward to expanding our team and deepening our impact. I express my heartfelt appreciation to our dedicated team, partners, and supporters for their tireless efforts. Together, we continue to strive towards a nourished and healthy India. Join us in our journey towards a healthier, happier future for our children, the Ayush way. Thank you so much for coming today. So now it's the time for me to welcome Dr. Malini. We have the privilege of having an esteemed expert in the field to lead this understanding. Dr. Malini Govindan, our distinguished guest, has an impressive and diverse background in medicine. After completing her MBBS in India, she pursued her MD in obstetrics and gynecology in US, where she also achieved board certification in her field. With over 14 years of dedicated practice in obstetrics and gynecology, Dr. Malini recognized the limitations of allopathy and sought to expand her expertise by earning a master's degree in integrated medicine and Ayurveda from Maharishi University at Iowa. She is also both certified in integrated medicine and fellowship trained in minimally invasive surgery. Dr. Malini has not only excelled in a professional career, but has also been a pioneer in integrating different medical practices. She established an integrated practice in Phoenix, Arizona, where she combines her extensive knowledge of both allopathic and alternative medicine to provide holistic care to her patients. We are truly fortunate to have Dr. Malini with us today. Her insights and experiences are invaluable, and we are eager to learn from her about the critical role of inflammation in various chronic diseases and how integrated medical approaches can make a significant difference in patient care. Now we can all join with me in extending a warm welcome to Dr. Malini Govindan. Dr. Malini, we are delighted to have you here. and we are eagerly waiting to hear you.
Thank you, Nirai, for your wonderful speech. Thank you, Mohan, for introducing me. Clear for everyone? So, as Mohan mentioned, we are living in an era of too many choices, too much information, and too much availability of resources too. But are we more confused? Are we less confused? Is the biggest question we need to answer. So I think with a lot of choices, have you ever wondered, you go to one of the grocery store, like a supermarket, to get some maybe parupu. You'll be standing right there. You'll be seeing like 20 to 30 options. At least with dal, we can go too wrong. But kids have the same problem too. You go to biscuit section, you will be like given 20,000 choices. Just exaggerating for sure. But if you want to find a healthy one, you will have to spend, it's easy to pick something that they like the taste and bring it home. But if you start searching for the content in that, you will not find a single healthy one. So we are falsely given choices, but very difficult to find a healthy one. That is why all the confusion comes from. So there's so many diseases, I'm sure that each of us are interested in particular disease, right? You go to a talk to a diabetes, recommendation, do this, do that. And then you also might have hypertension. Then you go see a different specialist. They will have a different recommendation. No sugar, no salt there. It keeps going, right? Each of us have multiple things. And then might be a cancer. Or you just have a lot of body ache and joint aches and you go to somebody else. Then what are we supposed to be eating in a day, right? It becomes very confusing. So when we start dividing everything and then start listening as a one thing instead of putting everything together, it's very confusing for people. So it's every day when you eat a meal, you start getting doubt. Am I eating a lot of sugar? Am I eating a lot of carbohydrates? But the other doctor told me because my cholesterol was high, she asked me to reduce the oil. So that conflict comes. You just cannot even sit and enjoy a single meal because of all this conflicting data coming from a different setup. That is where we're trying to see. There has to be a connecting dot, right? It cannot be. There was a great man once said that the greatest things in the world are always simple. Something is complicated, always think about it. Always comes down to most of the great things comes down to very simple. We just made it complicated. That is my goal. I'm trying to see, okay, very obesity. I'll talk all the diseases, just one whole spectrum of diseases after we dealt with the infectious cause. I think until like 60, 70 years ago, the major problem that we were facing were infections, plague, tuberculosis, leprosy, MMR, the mumps, those kind of things. That fight is over. We have a very good medications and good protocols to treat, and pretty much some of them even are being eradicated. Then all these new things have come. So now we need a better protocol to deal with this new stuff. So that is where I'm kind of working on to see, hey, how do we connect this dot? How do we find out there's one denominator? So what is one thing I can focus and get maximum benefit even as a patient? I always tell people and doctors, remember that I'm not different from you guys, right? I'm a patient in the same system too. We go through the same problem too. I've been in allopathy for so long. I'll go to see my specialist, they're my friends, but you keep upping, you go get an investigation, even it's impossible to even make them try to talk to each other. You'll go to a cardiologist, you'll go to your endocrinologist for your thyroid. So it's just like so that is where all this started. So that is what I'm trying to do. So I think inflammation is one thing that a lot of research is getting done, really, really coming as a promising understanding of what is going on. That's where I'm going to talk today, and then we'll try to understand the problem first. I think when we empower ourselves with understanding what is going on with ourselves, we can come up with a solution. We don't need somebody else to tell us, because why I got to inflammation might be different from why you got to that inflammation. That is where also why we need to understand the mechanism of what I'm talking about. What is inflammation? It's very, very simple to understand, but I'll try to make it as simple as possible. Anyone please feel to interrupt and ask me a question. My goal of this talk, if anyone wants to understand, I want to make sure you guys understand today. That is my goal. So please interrupt me and ask me if you have any question. That's totally allowed, please. So, and then also when I come to the solution, I really want us to discuss about how our ancient wisdom from Ayurveda, that's what I am exposed to. So that's why I'm going to talk about that. So why that will be an answer for inflammation, and how can we include that into our daily regimen, and also as a treatment if somebody needs it. That is how the talk is going to go. So let's move on to what is health, right? We hear this all day, all through everywhere you go, health, health, health. Can someone tell me what is health means for you? That totally can mean different things for everybody. There's no judgment at all. Vishwa, I told you I'm going to ask you a question, so I'm going to pick on you. What is health to you, Vishwa?
Being active and ensuring that we are vibrant.
Very nice, very nice. Someone else also? I'm not picking at anybody. Please feel free.
Not experiencing any pain.
Beautiful, right? So it's like, is it just an absence of disease is what is called health? That is what something, half of his project, right? Oh, everybody understand Tamil or too much? Okay. Oh, you don't have diabetes, you don't have hypertension, super, healthy irukeenga. No, right? But you ask that person, have you ever wondered, a lot of times you don't feel good, right? Your mind is dull, you feel sleepy, and your body's aching, and multiple stuff like hair fall, right? Simple things, but digestion, right? You don't, you're bloated or you're constipated. You go to doctors, and then they tell, have you done all the tests? Everything looks good. Okay, you come back home, right? That is the key. That is not healthy. It's a very early signs of your body getting disturbed. So those are the things, unfortunately, I'll come to the point how far we are ignoring, why we are getting in so much trouble. Because for any disease to come, the insult happens almost 20-25 years ago. And also repeated, in fact. Body is very healing and very forgiving. Some small insult, body will heal because there's a tremendous capacity to do that. But if it's a repeated trauma, then body is overworked. I usually tell in a way that I use very analogy and a lot of stuff, so it makes easy to understand. I also treat small children. So it's like a tennis, right? I also told the same example yesterday, right? One tennis ball comes, you're a superstar, right? You can get right there. 2, 3, same speed, 2, 3 balls comes. You can manage. Right? Then you start throwing 10 balls, 20 balls in the same speed, you cannot handle it. That's exactly what body is also doing. And one of the main problem with this is liver. Liver is faced with a huge load from all the stressors. So let's move on to kind of get to the next point. So just kind of think about it. What do you want to call health? Do you want to just absence of disease, or you want to feel good, both your mentally and your body? Comfortable, as he mentioned, I am vibrant, I think clearly. There's a lot of decision making is a problem. You will see youngsters these days. They'll decide one thing, 5 minutes later something else. There's no clarity. The clarity comes from balance. That is also, we're not seeing it as a disease, but actually one of the biggest problem of our current generation is that they cannot make up their mind. I'm sure teachers can agree with me, right? They cannot make up their mind. It is not their fault. It's the imbalance. It is just this chronic inflammation interfering with is somebody sitting next to you, nagging you all the time, right? We work best when nobody's disturbing us. I'm sure everyone agrees, right? You're doing some important work, but somebody's nagging you all the time, you can focus. That is what's happening with the kids. There's no point in blaming the kids for not being able to focus. It's just this chronic inflammation, this toxins or AMA in different language, or metabolites, what we call in medicine. It's really sitting in every part of our body, including your brain. That is why a lot of people can't sleep properly, a lot of people can't focus, we are irritable. Like the symptoms can be very dependent on where it's sitting and what is happening. So it changes based upon the toxins, not toxins, metabolites we're talking about. Some people get very worried when I tell toxins word, so I'm not going to try, I'm going to avoid mentioning it, okay. So now we're going into, first understanding is the key. Because if I give you just a solution, it is not a knowledge, it's not a knowledge, right? I want to give you knowledge. Then you come up with the solution. Then it becomes more wisdom when you start practicing. So let's dig into what is acute inflammation, what is chronic inflammation. So inflammation, even though I made it look like a villain, it is not a villain. It is actually our body's protective mechanism. It is actually trying to help us. We're overusing it, that's all. So let me make you understand what is acute inflammation, which all of us understand very easily because we see it, right? Acute inflammation is, and also I'll move on to one more analogy, right? This is a house, think as a country also, right? We all, let's say that there are 5 group of people, 10 each, we all live in this house. Each of us have a different job. There's one team that does the protection of this house, is like our military system, or this, let's call this a military system for our house, right? So their job is to, they have a small team. They make people stand all around this house, all outside the house also. They watch. Anyone coming through a door from outside, they fight. That is your immune system job, right? So it's when you have a lung infection, so there's a germ, bacteria typically, or virus, it can be a virus. Now we recently dealt with COVID. It is actually not a lung infection. COVID was slightly different pathology. That's why it took us some time to understand that. So let's not take COVID for that purpose. So let's say that it is like a pneumonia, right? That you get an exposure. So the guy who's standing at the door knows that there is a germ that walked into our body through the lungs. Then he alerts his entire team to try to fight with this guy. So the army sends a group of people to your lungs and trying to fight this infection. So what they do, they release chemicals because they need to throw a bomb or something like that, right? Because each military has its own way of attacking people. That depends on your strength of your enemy. Yeah, because some enemies are very strong, some germs are much more potent, what we call virulent in medicine. So they're based upon that. That's why mild infection, there's no fever. 2-3 days you'll get better. If it's a stronger infection, a stronger, much higher load also, right? One enemy, milder attack. 10 enemies, stronger attack. Same thing happens in body also. So the body is responding by releasing the chemical. That's what we call cytokines, and multiple names are there. Okay, those chemicals are supposed to kill those virus and all bacteria, or throw them out, whatever is possible. They'll try the best to get rid of them from the body. But during the process, also our cells get damaged because some of them are inside the thing. Then there is a cell damage too. So how your body's, then you have a fever, you have a cough, and you also have the chali, the sputum that comes out. This is all your body's reaction. That is your inflammation. Now the immediate attack is done. All the invaders are gone. They got killed or they got thrown out. The body is supposed to heal this because the tissue is damaged, right? So now let's say that this door is damaged. They need to fix it. So now they're going to, this is called fibrosis, or there are multiple mechanisms again. They call their one more person, team, who's supposed to fix this door right now because there is an open in the lung wall. I'm just making analogy, please don't take it directly. That's a tissue damage that needs to be corrected. Sometimes the correction, because damage is very mild, they can put a beautiful job that you can't even see the damage was happened. But let's say the damage was very deep, then there's a fibrosis, and that's when there's you will see, even you get better from the infection. Have you heard some people, they still can't breathe normally after their lung infection? It's because the damage was very strong. The repair, unfortunately, couldn't bring the function back 100%. Now there is a little bit of a residual damage. Some people mistake it as infection rika, is my still infection is there. No, infection is gone. The inflammation, unfortunately, has corrected this right now. There's a structural damage, unfortunately, that has to stay. That is the difference. So acute inflammation, you know your enemy, your body took care of it and repaired the damage. Let's say they're almost 100% recovered, you're fine, your fever is gone, you're feeling better after 2-3 days, 3 weeks, depending upon. Yes?
This entire process without external help. This is the body does it all on its own.
Yes. So that's why we don't give antibiotics in the beginning, right? Because if it's mild, body can take care of it. But when we know because some of those things we know for sure, if it's a real bacterial infection, we do have to give antibiotics. And also, they can't do anything for the healing, right? Because they can go kill those basically, let's say that this army was not enough. I'm just sending an extra army to help those people, that's all. They go kill those guys, that's their job is done. Now the body has to heal. The inflammation has to still completed by the body. So always the healing happens through inside. I always tell doctor, we are just helping from outside. So that's exactly, yeah. So if it's antiviral, we will give antiviral because obviously we don't want the damage to be too much, and then it can continue growing. It's also sometimes we watch. You take an X-ray, there'll be 1/10 of the lung affected. If they progress, then you're getting more and more lung affected. So depending upon no, it's very easy because we know who came in. We know we have a strategy to attack them because the body remembers those things. Why we had a problem with the COVID was this is a very new thing to our body. Any new insult, because we don't know this enemy, right? Our immune system creates a very extensive attack without realizing what else to do. But there's a memory. Next time, by the time they come back around, body remembers it. That's what we call, there's a memory cells in the body. There's an immediate attack. They know what to do exactly. That's why sometimes the first introduction to the kids also, I'm sure you know that when you send the kids to the school, because they're getting exposed for the first time, they get repeated infection. They're a little bit more stronger reaction from the kids for the same reason. So any doubt about acute inflammation? Same thing happens in every tissue. Urinary tract infection, you fall, right? You fall and you break your leg. Same thing happens. There's injury and then body recovers. Same process happens everywhere. So a lot of times the structure can be completely 100% back. Sometimes it cannot, depending upon the intensity. Sometimes, have you seen, sometimes you fall and you break, but you kind of have a little bit of a tightness after recovering because there's a little bit of fibrosis from your inflammation.
They haven't accounted for age in this, right? Age related. Now, what you spoke about, age was not accounted at all in here.
Remember that my army changes based upon my immunity. That's my immunity, right? Okay. So stronger country can fight stronger, weaker country can fight weaker. Your age will add to it, right? I didn't get there, but let's say that your immunity was low, you don't have your malnourished kids, or your older person, younger kids, your fighting capacity is not the same. Okay, I didn't put it into it, but it is intuitive, right? Intuitive. So that, same attack can be done on, I'm sure you guys have experienced in the same house also. Same infection, everybody will have, and then also there's a difference in prakriti too. I'll get to a point, there's a nature of each of us have a different nature. So we'll suffer accordingly, unfortunately. Okay, so good. So let's move on to.
After the attack, the inflammation should go down.
Yes, it'll go down. That's why your fever is getting better, and then you're not coughing anymore. You don't put up that chali anymore. That is the inflammation goes away. That is actually it's a very energy-consuming process. Actually, nothing is passive. Large amount of energy is needed for inflammation and also taking out the inflammation. Beautiful point, actually. The inflammation has to be taken out from there. It cannot persist there, right? Imagine like some village, the fight happened, the army went in, cleared up everything. If they're still sitting there, people have a problem with it. Same story. Same story.
So is inflammation the damaged tissue, or is it the body's immune response and like the residual, from that immune response at that site?
So the effect from can be two. One, as I mentioned, from the inflammation itself, that's your fever and everything. But also cell damage also can be problem too, right? Let's say same thing happened in your thyroid. Thyroid is not functioning right now. So the cell destruction can also give you symptoms. So there is, but as I told you, the cell dying might happen, might not happen. So it all depends on what was your insult. So the results of acute inflammation, what you're suffering, can happen from either tissue that couldn't come back, they died. 4 people died in the fight, right, like that. Oh, and then there is, because when they repaired, they couldn't really finish up the process properly. So both can give you the symptoms at the end of the day. Okay.
You mentioned that inflammation could be a good thing, not necessarily a bad thing.
No, we need this.
Yeah, so that's why, so when this fight is happening is when the inflammation actually happens, is what you're saying.
Yeah, this is our basic survival mechanism. If this is not there, we don't realize it. We are exposed to this kind of infection and we see sickness, but how much our body is fighting through the throat and your gut and skin, it's just, we don't get that many infections actually. So it's a constant fight, right? So that's why this is a survival mechanism. If this is not there, we wouldn't survive. So inflammation is it's an essential part, like a breathing, it's a part of our thing. But as I mentioned, remember the point that it's an energy consumption process. You need ATP or glucose. You need food. A lot of energy gets utilized for both inflammation and also for clearing up inflammation. That's why when there's a chronic inflammation, you don't feel good. You're tired because your energy is spent in a wrong place. Okay. So we'll get there. Okay, I'll get there why every symptom comes. So now acute inflammation, you guys got it because it's pretty straightforward. We know the enemy, we got rid of the enemy, and we also repaired our place. We're good enough right now. As long as it's here and there, we are fine. When the body has to keep doing it every day, all day, then you're wasting your resources, and your resources are getting exhausted, and so your normal function is not able to happen. That is where the chronic inflammation kind of plays a role. So now moving on to chronic inflammation, think of the same thing, right? Instead of some enemy coming from outside, they are kind of slowly sneaking into our house, or they are getting created right inside, right? And they sit among us. Very difficult to find who is what, and also there is also happening in one place, multiple places. We cannot really deal with it. We don't have enough resources. Some of us are good, strong immunity. It keeps fighting. So that is where the chronic inflammation happens. So what are the real causes? So I'll tell you what are the causes, then you can start connecting what it means, right? So one is, I always talk about for people to kind of make things simple. What causes, I always split them into this 4 category. I see them as a 4 pillars of our health and also disease, right? Where it's a problem, only we can fix it. So I always talk about like where all it can come from. I put them into this kind of a simple category for us to understand. Sleep is one of the very essential first to recover. Why do I say that, right? I mean, am I just telling because we are supposed to know, right? So our liver is, so I'll talk a little later. Let me talk right now. So we eat food, right? So and then everything gets digested. And then any toxins, because our GI tract is one of the biggest exposure of toxins, either from the food or food not getting digested, multiple reasons, because it's the largest area, largest exposure, including skin is also one more, and then respiration is also one more. So let me tell about gut, it'll be easier to understand, okay? So in the gut, we eat food and we get digested. And then from your intestine, they get back, everything gets broken down into small particle, but what body can handle. The terms probably you might know, glucose, amino acids, or fatty acids. Those are basic elements, and then some vitamins and minerals. Everything breaks down to this stuff, okay? They all go to your liver. This is your main, what we call Agni, or digestion enzymes in your intestine, and they all go to liver. Liver is the poor guy these days, get beaten up like overtime. That's a problem. So because he is the one supposed to be handling all these things coming from your intestine, so he packs up everything what he needs to, what body needs. I'm sure you guys have heard lipoproteins, right? When you check your cholesterol profile, those things are made in the liver. So what you eat as a food, because body has a mechanism to convert anything into anything. So your glucose can be converted into cholesterol. Only that's one of few things body cannot make it. Otherwise, any food you eat, body has a mechanism, mainly liver, as a mechanism to make all the substances, and then they kind of start releasing them into your blood, and then they circulate in your blood. Every tissue, because what I need is different from what she needs, right? Same thing in our body too. Every tissue needs a different thing. If a thyroid cells need a different kind of a nutrition for it to function. If it is a brain cell, it needs a different nutrition. They pick up from that blood. And then they are just same mechanism I explained to you happens in every single cell in our body. They have a mechanism to take their nutrition, use whatever they need to use. It happens in the mitochondria, and then they throw out what they don't need back into the blood. So this is a first we call one Agni in your intestine. Second digestion happens in your liver, and then third digestion really happens in your tissue. Have you heard your doctors tell, I'm not able to lose my weight? Because your tissue metabolism is low, because your tissue is not able to use your nutrition properly. Okay, so that is, I'm sure people who are menopausal are told metabolism is too low, I'm gaining weight. This is what it means. Your digestion probably is reasonably okay, probably liver is okay, but it can happen, disturbance can happen in any place. So that's just for you guys to understand that there is a digestion happening in every cell in our body. Everything has to happen properly for it to function in optimal level, and for us to, and also everybody, we are dependent on each other. We all live in the same house, right? Liver has to function properly for thyroid to function, thyroid has to function properly for kidney to work properly, and then all the need to be excretion needs to happen properly. Any block in this path can be a problem. Okay, so sleep deprivation. So as I mentioned, so now why is sleep important? And also sleep between 10 to 2. I know it sounds very, very, very important. What we call in that I understood from studying Ayurveda. Because our liver, I'm sure if you notice it, 9:30 you'll feel sleepy. After 10 o'clock you stay up, you become very alert. Have you noticed it? Because I've noticed this because I also work in the night. I'm a gynecologist and obstetrician. So twice a week I work all night. After 10 o'clock, you're all nice and bright, and that is because your liver is waking up. Your pitta is actually, and also modern science is also agreeing to this point, because now it's digesting all the stuff that you exposed today, all the food, now all that metabolic process I explained to you, that all that happening in that particular time in the night. That's why we don't sleep in the night. You're not given the time to the liver to function, to take care of things that happened today. And also not only liver deals with the food I told you. When you read the label, have you read that there's be 4 things that we can understand? There'll be 6 more things we don't understand, right? There's a preservative, sodium benzoate, nitrates, it can go on, right? Those things body, they don't know what to do, because they have a protocol to do, okay, glucose comes, if I need it for energy, if I don't need it to store, they know what to do. When these toxins come, liver doesn't know what to do because it doesn't recognize it. So what it does is it packs it up into and pushes it into the fat cells. That's where the fatty liver develops from. Fatty liver, and also any excessive thing, body stores in the fat. Fat is your body's dump site, right? Because it cannot let it circulate in the blood, because it can cause damage. It's a protective, again I always tell people, it's a protective mechanism. Don't blame your fat. It is body is trying to protect you. It is putting it in your fat. That is also why the fatty liver comes from. And then we still keep doing it. We don't stop, right? The toxins keep coming. Then they start using what is my backup. Okay, now this is full. I can't do anymore. Where else can I put this? When we skip that process, we over limit that. Then it starts sitting in the tissue. That's also one more thing. What we call Ayurveda is ama. That all this metabolites either coming from inside our body. So I explained to you about the food, but also what we think also matters, right? At the end of the day, body is chemicals. Body only talks chemicals. If I feel happy, there is a chemical, serotonin and dopamine, that chemical that comes out. If I get stressed out, there is a different kind of response. Norepinephrine, heparin, I'm sure you guys heard all these terms, right? So just give some simple example. I am supposed to give talk today. Let's say that yesterday I was worrying, ஐயோ இப்படி போகிறது தெரியலையே, என்ன கேட்க போகிறாங்களோ தெரியலையே. I'm super worried. I'm sure all of you have experienced. குழந்தைங்க நாளைக்கு கிளம்பி, they're going somewhere. You're like, okay, now, let's take a bigger thing, like wedding, right? The amount of stress we go through is like, like planning. I'm not telling you should not plan, you should not do. But that day, whatever you were so stressed out and thinking and worrying, you're releasing like say the 100 of ephedrine and non-ephedrine. 99% is going to go okay tomorrow, right? I'm sure we have seen an experience, right? 99%. Maybe there's 1 or 2 times that things didn't work out. It's okay, right? But whatever you released yesterday is not going to go anywhere. Your body still has to deal with it. Poor liver is the one again gets the work, okay? But we should learn that we have done this process again and again. I do a little bit of spirituality connection in this. I'm like, this is what is called cycling, right? You do the same thing again and again. I'm like, but you know that 99% is going to go okay. But I'll still get worried. It's like...
Here is a question where we look at self-medication, because all this what is chronic or acute, in a way is reciprocated by our thought process in the way of cure, right? I want to cure on my own or I want to go to a doctor, depending on the, what do you call, nature of the inflammation and the status of the inflammation. Status means whether it is going to be there for 3 days or will be there for 4-5 days, right? The point is that it basically boils down to self-medication or prescriptive medication depending on our anxiety level.
What do you mean by self-medication? That's the key.
We do it, right? Most of us practice it. I take a dose immediately.
For like a pain.
Yeah?
For pain, right?
For a pain, yeah.
I'm not saying it's wrong. Don't mistake me. I'm allopathy doctor. Don't mistake me. It's okay to take. I will never make you feel guilty, or that's never has worked, right? We have to understand. I'm not for suffering too, right? Today I have a headache. I'm not going to work on my diet to get my inflammation down. I still have to work today.
Sometimes we go to the extent of taking an antibiotic without prescription. Is it good or bad? Or where you are going to deviate into Ayurveda?
No. Antibiotics is a different story. I'll get to you're disturbing your microbiome. Dolo, it's okay. It's not safe or anything, but once in a while, yes. I also, especially after coming into Ayurveda, I know that if I disturb it, I will get a headache. I just, but a problem is, if I just think that my Dolo's fixed my problem, I don't do anything about it, then it's like, I'm at loss. So I will work on everything to reduce, so pretty much I can work on all the stuff, what I'm going to teach you, then I don't get my headache. But life is life. There will be some 1 or 2 days that I would have skipped and would have really been a lot of work, and I will get a headache. And I don't worry about it. I know exactly what happened. Then it's not a problem. But if you keep popping Dolo every day, now don't do anything about inflammation, it's the problem. That's all again. If you have fever, high fever, I'm not telling you should not take medication. I feel that, again, it's a damage control first. It's okay. If I want my body, I need to give a break to my body. If it's a high fever, 102, 103, body's not functioning right to fight things. So I've seen practically also, it reduces the stress because immediately your sympathetic system is working so much. I'll get there what the sympathetic system means, right? It's working so acutely and so intensely that itself can cause fear. That's what I'm telling you, please don't let them suffer in pain, because there's so many studies have shown pain itself is such a stress, right? Not ரொம்ப strong doctor. எனக்கு எதுமே வேண்டாம். Their heartbeat will be like 110, 120 from pain. I'm like, you're not helping me. Please take this medication. Let me work on your body, right? Please buy me some time. All I'm asking is buy me my time so that I can ask your body to give me some more time. That's all. That is it. So please do not mix these things. But just because you believe in this, don't think this is wrong. And we'll be at loss. That's how I see it. So I feel, and I should think that I also seen practically our modern system in a well-developed country can save so many lives if you act acutely and in a logical way, in a proper protocol way. So I do not question that wisdom at all. So I have equal respect for both. So again, exercise, those things are very simple. I'll touch on it very quickly. Again, we over-exercise. It's like, somehow I feel that we are either there or here. Why can't we come in the middle, right? Please exercise, but don't exercise for 4 to 6 hours, right? Because it's a stress, because muscle injuries, right? Some injury, body needs it. You need a blood flow to go, that it helps things to move around inside. So good exercise is so good, like 1 to 1.5 hours. I'll get to the recommendation. But over-exercising is a problem too. Over-exercising problem too, because you're making them overwork. So it's like your arteries get thickened, they will have a sudden cardiac arrest. It's like you're afraid of something. Now you're going to the other extreme. That itself can give you a problem. So please, everything in the middle. That is a mantra I'll discuss later, that please in moderation, everything. And then stress. It's like, this is one of the biggest problems that we are facing today. The sympathetic stimulation, right? What does it mean? People talk about this again and again, sympathetic stimulation. There are two, so I'm sure all of us understand our body is controlled by 2 nervous systems, right? One is the central nervous system, where all the nerves, our brain, our spinal cord and everything, which is typically voluntary and involuntary, the mixed. And then the other one, this one is controlling all our motions, our movements, everything. But our heartbeat, our breathing, those things are not controlled by, because they happen whether we are awake or not. Those are your digestion and everything controlled by what we call autonomous system, sympathetic and parasympathetic. Those, and also I think in our culture that's what they call Shakti and Shivan too. So it's so connected. It's if you understand our spirituality in reality, it's all about body. You will beautifully understand what's going on inside your body. So we need balance of those two, right? So sympathetic makes everything work faster. So let's say that it's a typical example given. Let's say that you were chosen your tiger. You see a tiger and it chases you. Your sympathetic system is have you felt it? Your heartbeat goes up so high. Now you have energy from somewhere, right? You run fast for your life. That is because your sympathetic things are working. So it makes everything work faster. Heartbeat can go up. Your respiration goes up. This is like upper. Parasympathetic is the calming balance. So we need a balance of these two for us to function properly. But our problem right now, we always are stimulating the sympathetic system all the time. Either we are afraid of our boss scolding us, or traffic, or so there is like a small tiger chasing us all day. So we are like that. That's how our body feels. It's on alert all the. If you're alert, that's what I'm telling you. If war has happened, everything is gone. Now we rest and we focus on other stuff. Then we'll be okay. But you're fighting all the time. Then you're getting tired. Body is utilized. So what happens? Body pulls all the resources from other area for fighting. That's what's happening. When the sympathetic system is working, who wants to eat when you're running? The tiger is coming behind you, right? The body thinks that you don't need digest. You don't need to do things. You don't thinking. Just run, please. All the blood supply goes to your muscle and the areas that you need to run. That's exactly we are doing without realizing that on a daily basis, on an every minute basis we are doing. You have a deadline to go, traffic to hit. It's like literally we are using the higher sympathetic system, chronic stimulation sympathetic is the biggest problem we are facing right now. So we are always on the alert, body's always on the alert that anything triggers very easily. Okay. So, and then toxins we already explained to you, right? Toxins can be both from what we are getting from outside. I don't have to tell you guys, the amount of stuff we are getting through outside is a lot. Just to make it simple example, the mother's breast milk has around 250 chemicals already in them. So that's why we're feeding our kids. That's how contaminated the system is. But I don't want you guys to be afraid. There's so much we can do. I am a kind of person, let's not focus on things that we can't control. Let's focus, there's 100 more things what we can do, right? I'm also sure that there's some of you in there might be in a system where you can reduce chemicals. I'm not sure each one's job is. Anywhere you're using, main exposure is for the toxins, a simple thing on a clinical level I'll talk about. Is what we put on our skin, right? Our cosmetics industry is really, so women be very careful. You know, like whatever cosmetic you're putting has a lot of chemicals in them. And also what you're using in the house, very, very, very strong chemicals. So organic food, and it is there. That industry has to change. That is a lot. But what I can do at home is what I'm discussing about, right? As much as possible, please reduce the exposure. And kids are very more sensitive than us. It's like when there is a damage, right? The bigger grown-up tree will have less damage. The younger tree always will have more damage. That's always true. Always true. And then maybe I should include, or maybe I should not. Sugar goes there. So I'm sorry. Sugar is almost a toxin, okay? Because the white sugar, is the way they process it is not good. Sugar actually is a direct inflammatory causer. So when you eat, especially sugary drinks, right? Coffee, tea with the sugar, or any diluted sugar, right? It goes directly and it goes to liver, needs very little energy to absorb. That's why you feel immediate energy when you drink a sugar drink, right? It passes through things very quickly. And then they come to your liver vessels easily. They also go to your, because remember from liver, the blood directly goes to your heart. That's why people with no diabetes, no hypertension can still have a heart attack is from this mechanism. Because as soon as the heart is getting pumped, the first one to get the blood is your heart vessels, right? It directly causes the irritation in your lining of your heart. Irritation vandadanaale immediately inflammatory markers they're going to try to fix it. That's all. Then the fat and everything comes later to get deposited and forms the clot and all that. That's later process. The inflammation, and remember, insulin is not even in the picture yet. Your sugar now the it comes to your pancreas, the pancreas is okay, this meal was too much of sugar, I'm going to make insulin. But damage is already done. First is heart, second is brain. These are the two biggest organs that get the blood supply first before even the pancreas realizes that it was high. So what we are checking in our blood is a venous blood. Remember? So meaning that after all this damage, after all the pancreas has worked, then you check your sugar, might be elevated, might be normal, but remember, it was after all this stuff. I always tell them if it's a high carb meal, doesn't matter, your sugar is normal. I'll get to the point. I will not give a different diet to different people. And also, recently, Nirai asked me, she asked me what I eat as some simple thing, and she asked me, what do your kids do? I'm like, they do the same thing. So please do not separate them. They have to, it's so important. No different diet for anybody. No, everybody eats the same. So that is why we'll one more thing to talk. Nasi ourselves because he's diabetic. No, we also need the same thing. Because it is same pathology at the base. So what is coming as a diabetes to me is coming as an hypertension to her, coming as something else to somebody else. It's the same baseline. Diet control, sugar control, moderation has to be practiced by children, more important than adults because they are our future and they are more delicate than us. Just to give you guys the intensity of the problem, right? So I have an advantage to see different country people. I see as a plus because I'm learning a lot from, why are our Indian people have more of this versus others? Starts giving me a sort of comparison. What are they doing different than us, right? So in our parents' generation, they had started getting this sugar issue and everything when they're 50, 60, right? Disagree with me if I'm wrong, right? I'm talking my experience. I'm not even talking statistics. That is not important for me. Then our generation, middle-aged people, we started getting the problem 35, 40. I am checking metabolic profile on starting people from 20 because I do integrated practice and also I know people for a long time and also I'm trying to learn from what's going on too because I know this process starts and when they're like really at 10. Because for you to really have that heart issue and the clot to form, it takes 20, 30 years. Then where is it starting? Starting when they're 10 to 15.
So this diabetes type 1 for kids, right?
It is slightly different mechanism.
That's genetic.
Not genetics, it's almost autoimmune kind of a thing. It's a slightly different, but definitely chronic inflammation also can cause autoimmune too. The thing is it's like constant what happening here, constant what happening there. When I try to damage a particular person in the middle, the surrounding person can damage too. That is autoimmunity. Body is a little bit confused. I need to take care of this, but I don't know how to shoot particular person. That is where the autoimmunity comes from. So your body is now a little bit confused. Why does the immunity go down? I'm so busy dealing with this stuff here. When somebody's coming from outside, I don't even know they're coming. That is exactly what's happening. Why your immunity, you're not able to fight the infection the same. Why you're able to still cause your own destruction of your cells too. Type 1 is slightly an autoimmune problem actually. So that numbers will go up too. Because same thing. Everything is connected. We can't say that this is going up. Again, same thing with the neurodiversity too. Same.
True. The one that you told with respect to sugar, right? We observe. Or chocolate immediately you can see the spike in their behavior because
that
it
is
goes to the brain.
Actually, it's beautiful to see that. We just are so ignorant. We're not
Manifest it well, I guess.
Exactly. Because they are manifesting it so quickly.
They completely abstain from all.
Correct. But why are we waiting for this? That is my thing. I'm like, I think our sugar consumption, our salt consumption, very, very high. I think they're talking about Americans consuming more. I think we do more than that because our meals also super carbohydrate. Don't think sugar is a sugar, right?
Yeah,
your carbs are like, what a teaspoon, just to give you some example, what a teaspoon sugar is approximately 5 grams. 5 grams of sugar. 1 cup of cooked rice. I think a cup is most probably none of adults will be enough, right? Then that is usually 25 to 30 grams, 6 spoons of sugar. That's all body will see. Again, a lot of people have a misunderstanding. They might eat fruits too. Again, when I tell vegetable and fruits are convenient, right? Kids love it, at least, right? Then again, each fruit has a good amount of sugar. That as I told you, at the end of the day, after digestion, at least there's no toxic stuff. If it's not let's say it's organic, no chemicals in them. I do agree it's a better alternative. but it cannot replace your vegetables, because vegetables have a lot of fiber with no sugar in them. They will slow down the sugar absorption. I'll get to the point that how you mix the food to reduce the damage. Yeah, so we didn't even get there actually.
You were saying that all types of sugar, including carbohydrates, chocolates, in a way has to be consumed to the minimal level as possible from a younger age.
So let's separate it separately, right? Biscuit, sugar and all a different category. Not non-food category. Because they also interfere with your absorption of other stuff also, right? Like pure sugar or like a chocolate biscuit, not only causing damage themselves. I'm telling you, they also are anti-nutrient. They also interfere with your vitamins and minerals. They are essential for your army to function. When they are not supplied, that's when they are anti-nutrient. So those need to be like limited to bare minimum. No doubt about that. Then moving on to carbs. Yes, I'm again, don't think they're white rice, millets. They're all carbs at the end. Right? Again, portion and how you mix the other food and what you eat first changes the game. And you want to reduce their absorption, what is coming into your body quickly. Biggest problem also with us is what we call naked carbs. Rendu idli molaga podi. Your meal. You loaded 40-60 grams of carb, maybe 5-6, maybe 10 grams, 12 grams of protein. There's minimal fat. There's no fiber to fight. And you also, by processing it to make a maavu, you made it super simple for body. Now it's like no fighting, nothing. Immediately your sugar will spike up. Same 2-3, because we do a very strict diet and also strict control of sugar during pregnancy. This is I learned a lot by my experience. We make them to check the sugars after fasting, and we make them check after 1 hour after they eat. And I also make them write down what they ate. Those are the things I learned from them. It's like same 3 idlis. If you ask them to eat with maybe sambar, let's make it traditional also. Sambar, but put a lot more vegetables in that. And please don't overcook the vegetable, because it's so easy again. Slightly cook it a little bit and make the dal and then a little bit of a coconut chutney if you're able to digest. We'll get to the digestion part later, okay? I'm talking about normal good digestion people, okay? Now then eat the vegetables first, because you're putting a fiber layer there, and then you're eating all this stuff and your coconut chutney, and then your same 3 idlis, your sugar will not go up and it will not start this cascade. That's what we call up is like you're mixing your food, different variety. That's what our ancient medicine taught to you. Mix things. You don't do especially kids. I'm sure like sugar, dosa.
It's almost like saying that you eat a plate of cut vegetables before having a plate of.
No, that's how you have to eat. That is the right way to eat. You're first supposed to eat your vegetables.
Fiber, basically fiber.
Vegetables, you put your rice.
And then if you're like a little bit more, you want to be like somebody who already has said diabetes and you're good digestion, I would even say please add like a sundal or something along with that, and then eat this. Your sugar will not go up at all. You'll feel good. You won't even feel sleepy after that, just because first fiber, then your protein source. Fat will be there mixed in that, right? Fat will be there mixed in that, and then some good digestive spices.
When you sleep, I feel sleepy after morning breakfast, after lunch and night dinner. Night dinner sleep is different, okay? But this is the reason for sleep?
Yes. Because what's happening, your sugar is going up. When your sugar is, if you're feeling sleepy now, maybe my talk is too boring. That's a different story. Maybe I'm not a good speaker. But that is why you feel sleepy. What happens is like your sugar goes up so high, then your pancreas is releasing insulin and then it dumps down. So both going high and going down, it's feeling the post dump. That's what you're feeling.
While all these things are being discussed, you put something called memory loss. So you'll be touching upon dementia, ADS.
It's hard to cover everything. This is to kind of tell you guys that anything you can think of will come from that. So this is to give you guys what all the background of inflammation can cause, right? This side everybody knows, right? Obesity, I explained to you, body's protective mechanism to increase the fat, and then diabetes, heart disease, arthritis, autoimmune disorders, because body is now confused and trying to attack its own cell because not able to differentiate separately. Hypertension and elevated cholesterol, and cancers, same thing too, because cancers, again, remember I told you more cell damage, because there's always our immune system is correcting it. There's actually, if there's no immune system, there's like so many cancers would come, but there's so many get cured up, what we call apoptosis, they get killed before they can become cancer. Now they're too tired, they're not doing their job. That's all it is. Okay, there's a lot more mechanism, but I'll make it simple. Okay, and then things are which is probably a lot of news for everybody is all the stuff. Aging. We age faster. We age faster from all this inflammation because again, our body's skin is not important when I'm fighting, right? I'm too busy for skin to renew, right? Those are last things I want to do. Okay, I say low energy, low lethargy, sleeping, feeling very sleepy. And bone loss, menopausal issue, all the the things that you feel before your menstrual, we call premenstrual syndrome, breast tenderness, heavy menses, painful menses, right? So muscle memory loss, actually, a lot of Alzheimer's have been connected to, not connected, it's purely shown scientifically that it's connected to chronic, again, same, brain is one of the very sensitive tissue, really needs high quality nutrition to do function. Because on a regular adult phase, 30% of our calories is utilized by your brain, even when we're not doing anything, you know. So and imagine most of us use our brain these days so much because most of us are brain dependent work, right? So imagine how much really good quality nutrition it needs. So, but the body is not able to provide that. That's why the memory loss comes. One of the important things is anxiety and depression. The main thing is like when there's so many children are getting diagnosed with all this stuff, we are just treating them with the medication, but we're not really giving them the diet advice and improving their digestion, talking to them, what are they eating, what are they doing. Because when the food is not getting digested properly or slowed down, our gut biome is getting disturbed. Most of our serotonin and dopamine, they come from our gut actually. That's what we call brain-gut axis. Very practical, right? When your stomach is, when you're not feeling good, you don't feel hungry. Have you ever noticed it? There's something, we have a loss or something in the family, we don't get hungry. Or we're super nervous, then you don't feel hungry. It's so connected, that's all. And so it's like, we can't separate it. They're super duper connected. And we keep treating only with the medication, not really fixing what is going on in their gut. We have to look into the diet, what they're eating. We need to look into how are they digesting it. You know, so many needs to be. Otherwise, there's going to be no answers for that. You know, and those medications are so many side effects. I'm sorry.
Is there a connection between hypertension and diet?
Hypertension and diet, yes.
Because of the salt. Otherwise,
Salt is only one simple thing. Chronic inflammation again itself, it can relate to even high sugar content eating, even though they say that it can lead to hypertension. So I'm sure you noticed that even if you make your salt like 0, it cannot be completely corrected. I'm sure you noticed that just because you haven't really fixed the whole problem. I'll tell you one very simple. You reminded me of one of my very close friend and my patient. Okay, hypertension, and she started seeing me. She knows me very well. And then wanted to work with me for her blood pressure issue. Very young person, 30, 35 when she started. Then obviously, IT person, long lifestyle, long lot of diet issue and everything. And we also started allopathy also. Our physician had given, she lives in a different state. I told, please start, but let's clean up all your diet and everything. Salt, again he told salt, and pretty much the poor kid had like literally stopped. Salt like 0, minimal. But food actually, there's a sodium already naturally in the food also. Even though what we take outside can go down, there's sodium in a lot of food. So there's no concept called 0 that what we did. And then still it didn't go down. Then I'm like, after a year, I knew that she was doing everything I told her, like very cleaned up the diet and everything. The simple thing I found out later was, she was raised in a very traditional family. But for whatever reason, now she eats non-veg. That was causing a lot of conflicts inside. She was feeling guilty, and those things was causing her blood pressure. So there's a lot of connection with everything, what you feel inside. Then I'm like, it's a food choice. That's your choice you made. There's no reason to. So there was a constant fighting inside her. Should I be doing this? Should I not be doing? Because she was raised in a different way. Now she lives in a different way. That internal conflicts is one of the biggest problem also now. That can give rise to blood pressure, a lot of problems actually, because you're constantly fighting inside, So that releases chemicals.
walking help reduce hypertension?
Kandipa. Again, as I told you, there's no separate treatment for diabetes, no separate treatment for hypertension. And there's no separate treatment for living, same thing. I tell so whether your labs are normal, not established diagnosis or anything, do we have a timer? 5 more minutes, okay. Good. Let's move on to treatment, so that is more important.
We're talking hypertension. Is 140 the new normal, or is it still 120 by 80? Is that still, because there's so much of controversy?
But the way I see it after kind of coming to Ayurveda, I don't worry about this. What is the definition? I'm like, what does the definition means, right? So I am like, I get people like borderline varache konjam start doing things what you need to do, right? That's why I screen the labs also very early, 2021, even like 16, 17, I show them they have a hemoglobin elevated because I'm seeing 20 years earlier. Trust me, what I see in US will come here in less than 5 years because your kids will already are developing this chronic inflammation because they really are going through a different kind of lifestyle. So, so I'm like,
So basically I'm asking, do we need medication for that? Because
I don't agree with
I
that.
find doctors immediately saying, I mean, I will prescribe for 140.
I know.
Thank you very much, but I never got it done.
Yeah. So again, I said number doesn't mean, but remember again, you don't want to be causing damage to your body because the most of the time if it's like level 1, level 2, level 3 blood pressure we call, right? More than 160 or 110 bottom numbers, they can really cause a problem. I mean, I don't want them to be running there and then not taking medication, trusting on walking, and no, that will damage. If it's mild borderline, please check it regularly. When it's borderline itself, you can pretty much correct it. You don't need medication. But if it's persistently going high and high, that means you're not able to pinpoint what's going on. And then the real discussion with one of the alternative medicine people might help you a lot. But sometimes you can figure out for yourself. First of all, each of us need to identify what's my cause. That is the biggest impact given by Ayurveda. Find out the cause and remove the cause first. There's no reason there's no point in treating if you can't remove the insult. First we need to remove the insult, stop it coming from more. So as I'm telling you, my recommendation will be the same for you and your kid and your grandkid. So I'm like, that we need to stop thinking that way. And also I'm not going to change. Yes, it'll be a little more stricter for you. Maybe I always tell them, when you are healthy, 80-20 rule. Meaning 80% eat healthy, what I tell you, 20% here and there, okay, body will forgive you. When you are already established dishes, do 90-95%, please stay like that. Once in a while there's a wedding or something, there's no reason to go sit there and do, like, I'm not going to eat. So body will forget. But just the problem is we are like so confused and we're doing opposite. That's the problem. So, yeah. So, like, do we need to get there? Let's get in the treatment, okay? So just a simple thing of like, it's very important to understand your body type. Because what diseases will come and how will manifest on your body is very different. It's almost like I explain to people that we are like a different kind of plants. I love plants to explain to people, right? I am a rose plant and you're a mango tree, right? We can take care of the same way for both of us, right? There are some general rules, but what to eat, how to exercise, all comes from knowing what's your body type. That is what Ayurveda, this is now I'm getting into what can Ayurveda offer to us right now. And a lot of people have a question, with this modern world, all the research and all the science, is this very relevant information? I think it's relevant more now than ever, right? Because now we took care of all the infectious stuff. Now we're dealing with this lifestyle stuff. Only answer is going to come from the real, trying to understand from body from like a base level. So understanding your body type, so she was talking to me like, same disease, how it manifests diabetes on one person who's a different kind of body type is different from others. So and your diet will change according to it too. And also if it's young children, if you make them understand the body type and then teach them how to live from there, they will not get disease at all. So just 3 people, that's a simple example, okay? Vata people, so can I spend 2 minutes? How much more time I have? 20 minutes?
We have come to 6.
Okay, sorry. Okay, 5 more minutes, then I'll start taking good. I think I covered a lot of the treatment as we discussed, right? I know, Arun. Just give me some time, like 5 through, and then I'll finish. Because this is like a never-ending topic. That's the problem. This is like not a one-time talk at all. Let's say that this has to be tailored to a diabetes. That will be like a few, and we can be tailored to an ophthalmologist who are there. Like we can tailor it to anything you need. Okay. So let's cover the general line. So please, Ayurveda doctor, excuse me. I've made very simple. As I told you, I treat kids, right? It's important for me to make them understand what is Vata Pitta Kapha. Everybody talks about it, right? You want to make a human baby, right? Doll. So you take a clay and you put a water, களிமண் எடுத்து தண்ணியை போட்டு you make a doll. That is kapha, water and earth. So if we need to understand kapha, think of a moist, wet clay, களிமண், you know that, right? Thick, wet, that is kapha, right? And then obviously we are not just களிமண், right? We feel warm and there is some heat into our body, right? That is your hot water. Right, hot water is what is making all the digestion function and everything. So now so what you see as a person is all kapha. You see me, it's all kapha that you see. And then you touch me, that is my pitta you're feeling, right? And then obviously I'm just not what now I told you what I see, what you feel. There's a master controller that you can see, you can feel. Those are the nervous system I explained to you. So nervous system and autonomous nervous system. That's your air and space. So you can see it, but he's doing all the job, right? Without those nervous system, none of the things are functioning in your body. So this is how I explain this three doshas to people. So do I have kapha vata? I'm standing and talking and breathing. That means I have all three, right? That is true with everybody. So now we understand. So if I tell kapha or kapam in Siddha, kalimanne. Then if I tell pittam, it is a hot water. And then air and space, just think of hair, don't even think about space, right? Space is there everywhere. So that, because you remember even a cell, the majority thing is inside a space actually, even though we see as a thing, the space is the majority what we see, what exists in this universe. So think of us as a wind, okay? This is all how it is. So I have all three for me to even stand and do anything. But the proportion will change. That is what is my body type. So let's say if I am a pitta person, I'm a pitta dominant person, then my heat is more. That's all it is. So for me, even though it's a healthy diet, I am drinking hot water. I saw on WhatsApp, hot water is very healthy. சாப்பிடுங்க உடம்பு குறைச்சி போயிடும். Nice, right? But I miss the point that I'm a pitta person because most of us know, right? Vata person is the thin, skinny people because they're more dominant on the vata. And then they're very, very hyperactive, they speak fast, they walk fast. And so if you start focusing and reading, you'll understand who you are, your face, looks, and your bones, everything, right? So hot water is, I'm not denying that hot water is healthy, unhealthy. But a pitta person drinking hot water every day, your pitta will go high. And then I'm blaming who put it in the WhatsApp. So, but it's not, no, understand how a healthy thing can be unhealthy. So that is, so your food, what you do, what you don't do, everything depends on your body type, where you live, right? I live in Arizona, which is a desert. Pitta person living in a Palaivanam, drinking hot water, and staying up in the night and working, staying up night and working. Just imagine how bad my pitta will be. Now you see, did I do anything bad? No. நான் ஒழுங்கா வேலை பண்றேன், ஒழுங்கா தண்ணி குடிச்சேன். Then I'm also, so I didn't do anything wrong, right? This is where the confusion comes from. எல்லாருக்கும் நான் சொல்றதெல்லாம் பண்றாங்க. I do everything what people tell me and doctors tell me, but nothing is working. But you miss the fact that I live in Arizona, right? That is, now you see, so how we have a body type, where you live, everything what you do as its own mind too, or own type too, right? நீங்கள் ஒரு தயிர் சாப்பிட்றீங்களா, it has a kapha, right? Because there's a lot of water in it. Kapha person eating a kapha thing, what will happen? சளி கட்டாமல் இருக்குமா? kapha. அதே that same thing can be a மருந்து for a vata person, right? Same thing. Now I see, that's why I'm telling you, please don't worry about பால் கெட்டதா. Same point. எவ்வளோ தண்ணி குடிக்கணும்? I'm like, no, this is like changes where you live, what you do, what is your body type. So it is nothing good or bad. It's who you are, what are you using it for, and what is your age, right? சின்ன குழந்தைங்க all kapha. Middle age we are all pitta because we are growing and metabolically you all understand. And in the old age we are going deteriorating, which is vata. Same, we cannot do the same thing what we did as a kid, our middle age. One more bigger problem I see why this menopausal problem is coming very high also. We are getting into vata phase, but most of us are in a very top level in our career. We are overworking, overthinking, that's what is why the menopausal things where எங்க பாட்டிக்கு வரல, எனக்கு அம்மாக்கு வரல, எனக்கு வருதுன்னா because you are probably executive in a company where you're not supposed to be doing this much tension work, and your pitta is supposed to be going down, your vata is going to come up. But unfortunately your pitta is still maintained because of your work and your thing. This is not going to change. We need to figure out this is happening. What do we, because அதுக்காக வேலைக்கு போகாதீங்க, அங்கே வராதீங்கன்னு, this is not practical. That is not even right to do that. So now you see how the same thing can be problem and good. Same thing can be marundu for you, can be poison for me. Even for you, remember that you change, right? Kulur kaalathila ukkanditu same thing in summer. So let's say that in a karam pudikkum, I'm a pitta person, right? I wouldn't enjoy it in summer. I will like, even I want to eat, I'll be like, okay, I know it's going to bother me. Winter, I will enjoy my pulikolambu. So see how same thing I'll adapt based upon, I know this will bother me. This is the knowledge this is how Ayurveda, why allopathy is not able to work. Same diet, same exercise, same marundu for everybody. That is where unfortunately we are not able to get to the results. But the tailored diet, same diabetic will be treated in a multiple ways based upon what is your cause and what is it, where the damage is, where is this lodged in your body, is why that this ancient knowledge is going to be the answer for all this, okay? Yeah. And this is a very simple example of showing you. Ayurveda puts, when you get a disease, they go in 6 stages, right? From normal, it starts accumulating and all the way up to the 6th, where it's already lost damage. When you diagnose a disease, you're already in a 5th stage. So that's why I told you, that is, now medicines are completely agreeing with that. For you to have a heart attack, that insult happened 20, 30 years ago and it's coming on and on and on, and the process started already. So actually they think it as a Satkriya Kala, right? So they don't see it as a, the way they explain is so beautiful, right? They don't see it as a problem. They tell you it's an opportunity to intervene. Problem irukku, fix paniko. So they see as an opportunity. If you intervene right in the beginning, and also they explain also in the beginning, it will be very generalized symptoms. Your stomach is bloated, like very mild symptoms will come. At that time itself you correct it, then it will not go there. So already, but a lot of us, unfortunately, by the time you have a set diagnosis, you're already up there. This is a beautiful thing to understand. No, that is too late, I already discussed this, how the 3 stages of thing, and also just include the microbiome into it. I think Agni also includes our microbiome, because the germs in our gut and our skin, they're part of us actually. When it's a healthy microbiome, they're actually, I think they have a lot more function. There are a lot of research coming in showing that they're not different from us. They are part of us. They might contribute a lot more even to a gene pool from them. So I think Agni probably included that too. So that's why I repeated antibiotics. Self-management antibiotic, you're really disturbing part of your team. You're killing half of your army by yourself. That means that you're really disturbing your balance there, can lead to a lot of problems. So that's why I'm telling you with antibiotics and everything, just be careful, don't self-medicate. A lot of them you don't even need it. So as I told you, this is very obvious, right? What can allopathy contribute, right? We are very, very good in telling what is the basic mechanism. So it will help us to decide what to do for you guys. So it helps in diagnosing the lab work will help us what to do. And also the general recommendation they talk that I feel that need to be tailored to a particular person. And medications definitely, if it's damage is a little bit there, the medications can help us buy time and help your body also to get some time. And also if it's acute complication, right, then it's helpful to treat that. So I think that's allopathy role. So if it's an acute situation where even a heart attack, stents have saved so many lives. So we need to, that is a modern allopathy's role. But we need to figure out what to do next. Otherwise you'll be developing something else in your body, So the true real wisdom is moderation. Enjoy everything in the moderation. Sleep in moderation, everything. That moderation is a word for your work, because there's also misunderstanding, myth that if it's a good thing, it's okay to stay up night, right? If it's work, padippu, paavum kolandinga. I'm like, that is actually really going to cause a lot of trouble for them. I already see it. They work for 10, 20 hours, they don't sleep properly. It really, really will affect their health. Everything in the moderation, because we don't want them to damage their body and then do study well and then damage. It's a cycle, right? It's a vicious cycle. Please teach them the moderation in every level. We have to think, do I have an answer for all that? No, but please start thinking what to do, because the answers will only come from you guys. You guys are doing it on a daily basis. Okay. So how is Ayurveda? I told you the biggest help is that it helps you understand who you are in a very early on itself. then it teaches you, then your triggers, what causes inflammation will go down. If you live according to your body, you sleep according to your, like what we recommend, law of nature, right? We are part of nature, right? Everything goes down with the sun, everything comes up with the thing, or we just decide that we're not going to follow that. That's what causing a lot of friction, right? We are part of the nature, we have to follow the things, sleep in the night, wake up in the night. In case some of us do have a role that we have to contribute to the community in a different way, staying up at night, but you have to compensate it, you have to compensate and reduce the body heat that would happen overnight. And also so it really gives you a lot of advice on how to really reduce those triggers. And also the beautiful thing that nobody here, unfortunately allopathy will not be able to, is you're removing the toxins that you have in your body. There's no way that, and digestion, remember I told you, that digestive health, there's no allopathy, I can reduce your acid, but there's no medication for me to change your digestion. I think digestive health is one of the biggest contributor from the Ayurveda, and also the toxins which are already there, which is called ama. Panchakarma is a procedure where they give you like a good medicated ghee with a different procedure, and they move all those things in your body to come out, So we recommend them, a small, like we're trying to find out some easier way to do, like every 6 months during a season change, like a little bit of, then whatever is there will come out. That's only place they can do is Ayurveda can do. I'm not aware of a Siddha what they do with the Panchakarma treatment. So they give you induced purgation because they move all the ama from your system, and then they kind of let it remove through your liver and remove through your gut. So very, very simple stuff to do. Really gives all the damage that's being done for so long can be removed from your system slowly. Within like 1 hour, I regularly do every 6 months with the guidance of a Vaidya, and very simple procedure. Just in 1 or 2 cycles, you would see a difference that things get, because they'll be sitting there in your system. That's what's causing all this.
System is saying giving so much importance in that aspect. We are also giving Vireshna for what?
Oh, you are? Okay.
Everything is there.
Okay. I do not. I'm sorry, ma'am. I don't need to learn a little more deeper into Siddha.
No, same thing.
Yeah. It's like very logical actually. Like say that you have a thick dirt, right? You put a water and right? Something fell in your wall and you're trying to clean with water, it's not going to go. Then put a little bit of oil and it'll go away. Because most of our body is fat, I explained to you, right? So that this oil that what snehana, what they call, and they give you, it really pulls all that deep dirt and makes it move. It's a very, very simple, very logical things to do actually. We're trying to put some simple ways to do. It's just like it's an intermittent fasting, right? So let's say that that's one thing I want you guys to be aware, but don't think that that's the only option and there's no other option. These are the small things, right? Intermittent fasting, body, remember I told you, give a body a break, body will take care of itself. Because if you keep using it, all the resources, we're talking about all this vitamin D, and that's also a reason why vitamin D and B12 is all low, because body is getting utilized too much. Nutrition deficiency is there because digestion is a little bit weaker, but those are the very, very crucial enzymes for liver to function and most of our mitochondria to function. That's why you will see that vitamin D is low because of that, because it's getting utilized more. Sleep, please, 6 to 7 hours mostly, and then at least 10 to 2 is a very crucial time. It is very hard for a lot of people, but as I told you, like more and more you follow the other things, that sleep will come naturally. So it's kind of like, now it's disturbed everywhere. So it's kind of like a vicious cycle, right? You have to cut wherever we need to cut. So I'm like, see, in this, start seeing what can you incorporate, and so that you will notice that everything else will fall into place. It's a common complaint, I think Deepa's also complained to me. They all tell me to sleep, but I can't sleep, what else can I do? I'm like, it is hard, I do agree, but it is a very vicious cycle of disturbance. So first day, yes, it is difficult, but if you keep following this in a consistent manner, your sleep will come automatically, because your brain is so disturbed, your sympathetic system is so hyper, it's not settling down. It's not settling down. And then simple one more thing to follow is, this is basic even for kids, 12 to 14 hours, no food, let's say 12 hours. When you go 7 o'clock, you eat your dinner, tomorrow morning 7 o'clock, don't start. Because we are not able to do prolonged fasting and everything what others do, it's okay, this is a lifestyle. But this is doable, right? So you stop, and then very difficult to do on day 1 again, but make a progress with change. Make it, let's say that you know 8 hours, right? Make it 8.5 hours. Make it 9 hours. Like prolong it. Another 6 months down the road, you include one thing at 1 week at a time. 2 years down the road, you will be in a different path to your health. Okay. So and then in another 6 months, you'll be able to. The 12 hours break is very important for the liver to cleanse everything, body to get a break. All those enzymatic functions and also molecular functions will get come back again. Okay. And sorry. Water is okay. We're just trying to not stimulate the metabolism. Yeah, because the liver needs a break, gut needs a break. Any non-calorie food like herbal, not coffee, tea. Water is okay. Herbal, like again. Sure. Yeah, it's like a flavored water. Yeah. Again, one more thing what I notice is frequent meals. Really, we need to avoid that. Digestion and food in Ayurveda and combine now is a big topic. What you need to understand, important what you eat, and then how you cook is important. How you eat is very, very important. Okay, it's just like distracted eating. We all use mixie at home, right? So let's say that you want to grind a coconut. You are in a rush and you put a bigger piece and put it inside and you're grinding. Have you noticed that it is not completely ground? That's exactly what's happening, right? Each machine can only handle its own power. If you didn't chew this properly, your stomach will get an undigested, unprocessed coconut that doesn't know what to do. Now again, that machine can only handle certain extent. Now it's like still cannot do it, jumps it like that in the small intestine. That is why your microbiomes are getting disturbed. The undigested food going into your small intestine is SIBO, and I'm sure you guys are, there's a lot of fancy word these days actually, okay, meaning that small intestinal bacterial overgrowth, okay. It is because this undigested food are fueling the bad bacteria, that's all. And then they're giving probiotics, antibiotics to that. So please chew your food. Please sit and eat, number one. How you eat is, how you cook, do not overcook your food, do not fry your food because it's becoming toxic. Because I'm sure you heard one more. I'm also trying to cover some people who are learning some YouTube new terms also. Sorry if somebody is missing it. Glycosylated fat oils. I'm sure you guys are hearing that a lot. When you're heating the oil very high, when you're frying the food and everything, the molecular structure on your fat is changing into a very toxic material actually. Body cannot handle it. Very, very inflammatory. Okay. That's also the reason why we tell you please be careful how we are cooking your food. Don't overcook it. Cook it with water and add healthy fat from a natural fat like a uncooked coconut or nuts. Those things are healthy. I'm not telling you even avoid oils, but overeating the oil is very, very dangerous. Even good oils are becoming toxic. Okay, that's one thing I just need to touch upon. And how you eat is please very, very important. Otherwise, same food that can be in nutrition in your body by itself is becoming toxic, right? No distracted eating. And because food, I'm sure all of you experience, the minute you start cooking, your brain knows already, right? You start making those enzymes. Already, that is enzymes basically, right? That's enzyme. That's happening in your stomach also. That's why it's important we cook the food and we sit in the food when the food is because the smell is coming. Now you're already ready. Your body is ready. Your digestion, all the enzymes are coming out at the same time. That process is getting hampered. That is one of the biggest inflammatory thing we are doing. It's a healthy food that you ate, unfortunately, but this didn't do it right. And digestion is also very, very, very important. By doing this again and again, our digestion is super confused. So it's not doing its job. So, okay. And exercise, I tell them like don't complicate it. Please, looking at the YouTube, please you don't need all that. For an average person who's good brisk exercise of 45 minutes to 1 hour, kids definitely needs a solid 1 hour because they're growing and they need it. And then everybody else, please need to be active. And also, there may be some yoga people might disagree with me. Yoga is good. I'm a big fan of it. Please do not replace it for exercise. Because it doesn't really, I mean, personally, I've seen that you need both. You need a good cardio. You need to tone your heart and your lungs. And then yoga is very good for like a coordination and everything. But a lot of people, what I ask them, and also they're not doing like a good Ashtanga yoga or anything that is very strainful. That can be replaced. But simple yoga stretches are stretches, good for you. Please do it good for balance. But that is not replacing your exercise. You need a good brisk walking. 45 minutes to 1 hour. Okay, again, tomorrow you don't have to start. 10 minutes, 15 minutes, in another month, to 30 minutes. Just do consistently. You do it because you enjoy it. Don't do it because I told you, right? Because this is fun. Learning and employing and making that what I told you as your own wisdom it's a beautiful process for yourself. You should enjoy it, right? Nobody has to force us. Then I'm telling you, 1 year, 2 years down the road, you'll be like so much different from where we are today. Okay. Yeah. Those are all what we call cardio exercise, right? Anything that works your good heart and muscle, and especially this is very good. Swimming is very good. Also low impact, what we call is good. Yeah, any of those things, biking, whatever it is. Okay, this is my vision, right? So you can see how those things blend. There is a false projection that they're two different paths, right? They're not. They're such a beautiful, they can work together so nicely. We can benefit, both systems can benefit from each other. Ultimately, as a people, as a patient, as a population, all of us will benefit from these things start flowing. I've seen some extreme different things also from Chinese traditional medicine coming from. So we need to start, acupuncture. They have like a huge studies and pain and everything. We need to start moving towards that. Okay, this medicine is doing that, let's bring that. So we need some integrated, real genuine integrated centers with a research thing and real bringing them some newer healthcare all of it can benefit. And also we need to make this affordable too. I'm sure all of us are familiar. I mean, how much we are spending for healthcare across the world is unsustainable. It's not going to sustain. I'm sure all of you experience it's breaking down already. So we need an affordable, how do we make this cheaper? That we need to start coming up with the really practical models. And also we need to make it, we have to start thinking globally, right? So it cannot be a very huge disparity from one place to other place, which is not acceptable in this era anymore. We need to start, how do we make this more equal for everybody? Everybody can access this kind of a knowledge and a healthcare. Thank you for listening. I genuinely appreciate you guys taking time and coming on Sunday to listening to this. Thank you.
Any questions? Yeah.
Ayurveda doesn't suit me because of mental friendly.
Are you first bencher in our school? There's a term in school will tell the first bencher will always ask questions. Oh, no. Ask all the questions. No, I appreciate it.
Ayurveda doesn't suit me.
One second. Okay, not suit. It's how to live.
I do what's this?
Okay, maybe some particular herb or medication what they gave you might be a problem. Again, at the end, they work by eating you or that's okay, that's really simple. Okay, but again, is that right? Again, and those differences can be solved. Okay, again, completely analyze funny. Again, I completely tell them herbs alone is not Ayurveda. That's a misunderstanding. Okay, 80% of the better people first thing is down. This is giving medication is supposed to become one more. Okay, no. 80% always is like, hey, who are you first of all? Understand who you are, and then live accordingly and eat accordingly. 80% you don't need medication. Some people might need some assistance, then we will add. As somebody sitting and writing medication, you should be a little bit careful. Right? So again, I always tell them there is more interaction. There cannot be allergic or anything at all. It's like I'm allergic to my pepper. It's like how can you be, right? Correct. But if I'm pitta, pepper can make my pitta go up. That is logical. So just no. Yeah. Did I answer your question?
Yeah.
I have been taking allopathic medicine for the past 20 years for the diabetic. Can I change it now for the Ayurveda?
Changing is not a term I like to use.
Okay.
Integrate, right? So now, I told you that yes, please do not change anything from your allopathy. Keep your doctor also. Plus, see a good Ayurvedic person. And then try to combine, because most of the Ayurvedic doctors want to work with allopathy doctor also. Then they'll correct your diet and give you recommendations. Sometimes can also add herbal stuff. It'll prevent you. Have you noticed that if you're diabetic or hypertension, this year you will start some, let's say that 5 milligram of something. 2 years down the road, it'll be 10 milligram. Now 5 years down the road, it'll be the double dose. Have you noticed? I mean, do you guys disagree with me? No, right? Because we never fixed anything, right? That is the problem. That will be prevented from doing the lifestyle changes. and living according to your body and according to nature, and also some herbs will help. And also will reduce the complication, right? Sugar normal, you shouldn't have gotten the nerve damage. I shouldn't have gotten the kidney disease. I shouldn't have gotten all that, right? In spite of being strict control itself is a lot of people are able to achieve. That's a different story. Even that, those you'll still get. That is because you never fix the basic problems. That is why it will help. Any disease, anything, even normal living, right? I tell, because I know that this woman is going to go to menopause. You need to start getting that kind of advice, that kind of a lifestyle, so that you know it's going to come. Chinna kodandanga, yeah, puberty is going to come. It's not something. Then you start getting them ready through the Ayurvedic lens. Okay, this is the kid. Okay, in Sariya Valarla, what nutrition does she need? That kind of, then you need to start preparing up. So, yes, I answered. Yes.
Someone there had a question.
We answered her, yeah. Our first bencher.
So I saw this interesting YouTube video discussion between one Dr. Mike and Dr. K about Ayurveda and the inability to do population scale trials or RCT in Ayurveda.
It is very difficult, yes.
How do you establish trust then, right? Like, how do you, if it is individualized, how, if I know you, that's fine. And I need to know you for like some amount of time, right? But like, how does this scale? How does
this scale this up?
Yeah.
That is why we are all working on. That is why the research is coming out. With the way our herbs are very, very difficult to study, because a group of herbs. It's easy to establish how ashwagandha works, like it's an immunomodulator, and it's easy to do one single herb. But traditionally it's given along with other 6 herbs. Actually, it's a lot of much more intelligent, because one single herb will not go into your body properly. So they come along with your digestive spices too. And then they also sometimes they do the ghee so that it can go to your brain too. Now it becomes a problem to study, like especially like a control study, because it's like, how do I establish like a 10, 15 herbs individually, because they want the biochemistry, they want to know what is happening. There's a lot of work is getting done. So I think it's a thing in progress. So sometimes I feel that, are we still in that kind of a proof kind of a stage? I think that era is going to go away very soon. That's my feeling. Because I've been in the US, I'll go to a big scientific meeting, okay, 2-3 days. I'd be like mind blown, scientific. My God, they're talking like some extensive molecular biology research and this and that. And I'll be like, what is happening? I'll come back to clinic, like start seeing my normal day. Reality, I'm like, we're not even done the basic stuff, not even connecting, right? This itself is not fixed. So I feel there is a huge gap, the way things are moving in the research field. A lot of resources money is getting spent there, but no practical use. Are we still believing that system that is going to give us an answer is my problem. I don't know. I kind of see that. I think that era is gone. Prove me. I'm giving you pepper to eat for 5 days and see for yourself, and you won't proof for yourself. Yeah.
So
We are working on it. Yeah, we are.
Now only the evidence-based medicine is a fashionist professional advice for every public people. But the evidence-based medicine only is not a fundamental structure.
So she's asking the evidence-based medicine is what I'm asking, right? The evidence-based medicine is new to our system, but evidence-based medicine has been in other countries, especially in US, for more than 20-30 years. But now I see that the evidence-based thing is going away. We're still doing it. That's my opinion, sir. My opinion. Because very difficult to study, very difficult to say. I do agree with what you saw on the YouTube. Very difficult to study randomized control trials and everything. If that is what we're going to believe in still, that's going to show us the answer, I think that phase is over.
So in your practice, do you kind of like take informed consent from patient and like?
Only if it is digestive herbs and everything, and also so I do get informed consent, yes. But what I see is when I really genuinely talking to them and explain to all this,
It means a lot.
It means a lot, and also they trust you. That's all. Yeah. Then they're willing to try, and then after when they get a benefit, then there's no for me to. They're like, okay, sure, that is what it is. Yeah. There's a lot of YouTube things are there. Start looking into it, but slowly start understanding. By looking at person, you can start telling your the face. One of the simple thing I tell is the kai. This right. Because we do a lot of imbalance can change how we look and everything, right? Because also now a lot of artificial stuff and everything is very difficult, but the bones don't change, right? So see my wrist, your own finger will cross. That's usually dominant vata type. Just only here, because remember I have all 3 too. For the Pitta person, it'll just touch. Kapha person, you can't even reach. The big bangles, big things, those things will tell you. See, Kapha. உங்களை பார்த்தாலே கஃபா தெரியுது உங்கள் ரவுண்ட் ஃபேஸ். But that is a big talk. But now that you know what it is, start researching into it. It'll be fun. I won't give you answer. You come back and tell me who you are. அதெல்லாம் எனக்கு தெரியாது. ராசி சொல்ல முடியுமா? That part I haven't ventured. Yeah. Thank you everyone. Again, I really appreciate it.
Thank you so much, Dr. Malini. I felt like I'd been in a science class. My science teacher is taking a class. There's no way that I thought that she's a medical person who has done a gynecology practice and she's there with us. I think it was a very interesting session. And every point she told was as if turning towards Nirai and telling, hey, this is entirely for you. So it seems so. So thank you so much, Dr. Malini. I think everybody would agree with me. Thank you so much. Now I call upon Deepa to give the vote of thanks.
Formally, thank you everyone for being here, and thank you Dr. Malini. It was a wonderful session. I think we miscalculated the amount of time we needed to understand. From next time it's going to be longer. But those of you who are here, if you have registered and put your email address, we're going to trouble Dr. Malini to give us this in a little more detail for us so that everybody can read. Yes. So we have already asked her this. So please register if you have not registered.
Self-learning. There's no replacement for
No,
self-learning.
we need some pointers from you. So the pointers will come to you. So then if you have any questions, again, you can reach out to us and we'll direct you to Dr. Malini. So thank you once again for coming and making this such a wonderful evening. It is a mini 10th anniversary for us, and thank you our guests and everybody. Thank you so much.